My vision is very important to me, and I thought to myself, if there was a possibility that I could have the best vision available, that's exactly what I wanted. I had absolutely no pain during the surgery, and it was a simple process of coming in and having Dr. Reiser look down through the laser, and bam, bam, bam. The next thing I knew, I was walking out, went home, and I was impressed with my vision. Even an hour after surgery. When you can come in the next morning and see colors, the impact is just, it's dynamic.
I refer to eye care specialists for numerous reasons. The main reason is that I had the opportunity to watch a lot of the surgeries performed here by many different doctors and see just how talented they are. They're using state-of-the-art equipment and new techniques. They're doing state-of-the-art research. And so I'm confident that my patients are in good hands here. Seeing it from start to finish, seeing the patient's perspective, I feel comfortable referring here, knowing what kind of experience they're getting.
I decided to see Dr. Savage. I went through the entire process of testing, and which was very quick. Surgery was scheduled, and the entire process was, as I said, very efficient. And the operation took no more than a half an hour. The first operation on my right eye was incredible. That day was almost instantaneous. I could tell the difference between when I went in and when I came out. I couldn't believe, truly I couldn't believe it.
I was the person who could not leave the house without contact lenses or glasses. And I decided that I was so ready to go with this. Painless, and before I realized it, it was over. The staff here is fantastic. Everyone was extremely friendly from the minute I got to the door until we had basic prep for the surgery. I'll never forget the first time I drove. I must have read every single road sign, like, you know, what was 5 miles away, watch the potholes, dips in the road. I read every sign crystal clear. It was fantastic.
Hurt a little tiny bit, like a little pinch, but it's nothing to worry about. I would rather get Botox than go to the dentist. The staff is wonderful. Dr. Roth was wonderful. He actually showed us everything he offered, which was great because he has so much to offer. So I would say I would definitely come and see Dr. Roth, if anything.
Vision is very, very important to people. for thousands of times now over the last 30 years, people would, when we're talking about their vision, people would say, I'd rather do anything than go blind. I'd rather lose anything else but go blind. So it obviously matters to people. And so it's important. I try to make sure people understand what's going on and talk to them so they can clear plain language, not a bunch of technical jargon.
What I like about the surgery is it really requires sort of some creative thinking, because every case that we see is different. And so determining what type of surgery we're going to do, how we're going to fix the problem, whether it's a retinal detachment or another type of problem, it really requires some sort of advanced thought and development of a plan, which I like.
Satisfying to treat patients in the elderly population. I think in a lot of ways, some are more active than others, but many of them have other medical problems, and losing vision just really contributes and advances those other problems. So to be able to stop their vision loss and keep them functional from that perspective is very satisfying.
I'm most passionate about making people see better again. To this day, having done literally 32,000 cases, it never is tiresome to have someone come in and be excited about seeing again very well for the first time in perhaps years. So that is a fundamental great thing to do and never gets tiresome.
What I'm most passionate about in ophthalmology is probably the glaucoma management. It's a challenging disease to treat and manage because it never goes away. It's kind of like diabetes or asthma to some degree. You can treat it, you can manage it, but you have to stay on top of it constantly. There's for the most part no cure for it. Now you can do surgery and make it stabilized, but you cannot make it go away.
I think mostly it's just enjoying seeing the patients, doing what you can for them. The technology is great as well, and I'm happy to have stayed up and be current with that. But I think it's really the patients and doing what's right for them.
The philosophy here at Eye Care Specialist is what we call total eye care. So we have well over 28 physicians in our practice. And it's what I like about it is we are able to service the patient and all. So we have physicians who I would call our primary eye care providers. So they do from basic eye exams to glasses to contacts, healthy eye exams, diabetic exams. And then when there are problems for patients either identified at their routine eye exams or patients who have been told they have a specific problem, we have a very large wealth of subspecialties, from retina to glaucoma to cornea to oculofacial plastics to cataract. So we are able to provide here in Northeast Pennsylvania total eye care for our patients. And it's a real mission, and we're very excited to do that.